So I am Zinzile Seepie, and in my capacity right now, I work with human rights in childbirth. So I've only started working with the organization since around late September. And what we've been doing on a day-to-day basis is trying to organizing this amazing conference that we've just put together. The work that I do here in South Africa with human rights in childbirth is that we seek out to understand exactly what the nature of human rights violations within our private and medical healthcare systems looks like. So what our biggest work is understanding exactly what the question is regarding human rights in childbirth, and then starting to formulate solutions to help and assist women and families in those situations. So many. We have so many challenges in the work that we're trying to do in human rights in childbirth currently. I would say the biggest challenge of all is that women don't even know that their rights are being compromised. So as much as we would like to educate the consumer, because we do recognize as human rights in childbirth that it's not us who are going to be the saviors of women, but that women as consumers need to stand up for their own rights within the realm of childbirth. So the main challenge is that women don't even understand that they're being that they're being abused, that their rights are being compromised. Women don't know what their rights are, and this is really cross-sectoral. So women in the first economy who access private medical health, they are cut for seizures at rates that are alarming. There are hospitals in Gauteng that have cesarean section rates that are over 80%. It's difficult to even find an OB-GYN or a doctor to support your birth if what you hope to have is a vaginal birth. You know, natural birth in South Africa in so many communities is like this foreign French thing, you know, like why would you want to do that? Why would you want to suffer? And that's the medical provider advising you at that level. And then for women in the second economy, their concerns are just trying to get access to antenatal services, just trying to get dignified access to maternal health, and specifically maternal health for now both the women in the first and second economy, woman-centered maternal health. In my opinion, maternity care that serves women's lives doesn't tell women what they need. Maternity care that serves women asks women what they need and recognizes the woman as the authority on her body. Maternity care that serves women allows women to express themselves fully and really experience their births not as inactive, incapable, lame human beings, but acknowledges that they are strong, that they are intelligent, and then where their body needs the support comes in to support them, to hold them, to carry them, and give them then the medical assistance that they need. The biggest barrier to the realization of human rights in childbirth is human rights in childbirth is a small part of a bigger community of human rights violations which occur within our society. So I think that there are structures in our society that put less value to women than to men. I was speaking to a colleague today, Dr. Aaron Mujajati, and he said if men gave birth, there would be no need for human rights in childbirth because everybody would be so kind and so wonderful to them. And I think in a society where women are not valued, then a lot of criminal acts can happen to them and are not as important. So in order for us to really save and to really come to a healthy maternal system, it would require that women in society